We're talking about Lyme disease and joined by Dr. Jess Armine, who is a co-founder of Bio-Individualized Medicine. He is from Philadelphia. He's here in Scotland taking clinics. He has immersed himself in this condition, which seems to have confounded so many people. And certainly we've had so many people getting in touch with us saying that they've had difficulties getting a diagnosis, they've had difficulties getting on a treatment plan, and more to the point, their lives have been seriously affected negatively because of the symptoms of Lyme disease, which there's quite an interesting collection of symptoms, and it doesn't seem to occur in two individuals exactly the same way. And Jess, just before I go and speak to some of the people who have got personal experience of Lyme disease, where I was getting to, in terms of what you were telling us there, was that there is no one cure-all for Lyme disease, and that it, for a variety of reasons, will affect each individual differently. Is that what you're saying?
That is the God-honest truth. What controls the expression of Lyme disease, if we're just going to hone it down to Lyme disease, are several factors. Number one, your genetic predispositions, okay? If they're allowed to express and you have certain difficulties in the genetic pathways, you might have it worse than someone else. Two, your general state of health. Three, how many exposures you've had, okay? And that will determine the state of your immune system via that cell danger response that I was speaking of. Also, any comorbid conditions you may have, like diabetes, like yeast, like viral infections and so forth. They all conspire to make the expression of the Lyme disease, if we're just going to hone it down to that, different in every person. The treatment of it can vary, okay, but should be build the foundation first and kill the bugs. You see, we're treating it from only one end. Okay, we should treat from both ends. Okay, that's what will make it successful. Okay, and when I say that I don't cure Lyme disease, what I do is when I'm examining someone is I usually get people, I'm not the first doctor, I'm the 4th, the 10th, the 20th. I'll listen to what everybody's, who's treated what, and they've usually gotten very good, knowledgeable treatment, but there's the stone left unturned. So if I backfill in that stone, the treatment that they've gotten actually does in fact work. Okay, and they can achieve a cure. But if you just treat with antibiotics, you'll never achieve a cure. If you just treat the foundation, you'll never achieve a cure. If you put them together to make the body whole, that's how you cure Lyme disease.
Okay. Ingrid is on the line. Good morning, Ingrid.
Hi.
Hi. How long have you had Lyme disease, Ingrid?
Well, I never remember being bit by a tick. But I suspect I've had it since my teens. I'm now 36, so I've had it quite a long time.
And when you say you've had it, what is it? I mean, how does it manifest for you?
Well, I mean, my symptoms started in my teens, like I said, and they were all kind of unrelated or seemingly unrelated symptoms, like my jaw would lock, my neck would lock, I'd get recurrent sinusitis. I also had random breast milk production, which would give me mastitis, and I was only 18. And
so you hadn't had a baby?
No, I had no children, and the doctors just kind of said to me I must have hormonal imbalance. I would see a dentist for my jaw, I would see physio for my neck, and then by the time I was 21, I had stomach ulcers, IBS, skin conditions. I would react differently to medications. Then by the time I was 25, I had gallstones, I had my gallbladder removed, and then around the age of 30, I started having recurrent shingles. So I've now had shingles, like I'm 36 now, I've had shingles over 40 times in the last 5 years. And then in amongst that, the neurological symptoms started. So I would say that although I've had it I think I've had it for a long time, it's really only the last 5 years or so that have been horrendous, you know.
Mm-hmm. And Ingrid, what led you to conclude that that collection of symptoms over that length of time was in fact Lyme disease?
Well, when I first read about Lyme disease, it was after John Caldwell had been on the news, and it was I ran a dog walking business at the time, and I struggled to, but one of my clients suggested that I have a look at Lyme, and when I started researching it, basically my medical history read as the symptoms for Lyme. I didn't know that all these little things that I'd had in the past, the weird illnesses and the recurring infections and things, I didn't know that there was a reason for that until I started reading about Lyme.
Mm-hmm. And have you had that diagnosis confirmed by a medical professional?
Well, on the NHS, I'm diagnosed with chronic fatigue and fibromyalgia and IBS and probably a list of other things. I began treatment before I had a blood test confirming Lyme. I had been tested through bioresonance, and as soon as I had that test, I started trying to figure out how I was going to be able to get access to treatment. But I've since had a private blood test through Lyme Aid UK, which confirmed Lyme and chronically suppressed immune system, which I kind of knew by the recurrent shingles.
Right. And now you employ bee stings, is that right?
Yeah, so I was so ill winter 2015. I had to sell my business. I could barely walk. I couldn't count. I just couldn't function. And I had no money, so I had no access to tests to see which co-infections I had, or, to be able to go and see somebody abroad. And my research led me to bee venom. So I started researching the science behind it and showed my husband it all, and we just decided that it was better than just sitting in my bed getting worse.
So how do you do that, Ingrid?
So before I started, I had to persuade my doctor to provide me with an EpiPen. There's lots of supplements and there's so much to learn. So I'm definitely not suggesting that people just go out and start stinging themselves with bees. But I had to find a somebody that would supply bees for the whole year. And there was just so much to learn. But, I just started like everybody else, start with a testing, see what your reaction is to that, and then you build up slowly. So it took me a long, long time to get to 10 stings 3 times a week. But I'm so much better than I was. I'm back on my feet. I'm trying to set up a new business, and I can live again. I was at a festival last month. I couldn't have dreamed of doing that, for quite a few years there.
And that is the only thing that you have been doing differently in terms of managing your condition? I have been using bioresonance as well. I'm really fortunate to know a lovely lady. I don't know what that is, actually. What is that? Bioresonance, probably Dr. Jess would explain it better than me. It's an energy medicine, and scientifically...
The easiest way to explain bioresonance is there are certain frequencies that will break up microorganisms, and it was studied by Dr. Reif. The easiest analogy is think of the opera singer who can sing a certain note and break a glass. If you knew the frequencies that would tear apart different microorganisms, you could put them through the body and you would kill the microorganisms that way. Right. Okay. So with that two-pronged attack, if you like, Ingrid, you're seeing a noticeable and marked improvement in your condition? Absolutely. I mean, I couldn't work. I couldn't get out of my bed. I was not functioning very well at all. And I very quickly realised that bee venom was going to be worthwhile. Mm-hmm. As soon as I started, I mean, the pain relief you get from bee venom is better than any pain relief that I've had from the doctor. Have you had antibiotics? When I initially read about Lyme, I went with all my papers to the doctor and said, I've figured it out. I know what's wrong with me. And she said, oh, well, Lyme's quite rare. It's probably not that. And bear in mind, I live in the Highlands, which is a tick-endemic area. Mm-hmm. So the information isn't there. The doctors don't have the information. But
if you look at how they test you on the NHS, it's an antibody test, and when you've had Lyme for a long time, Lyme alters your immune system response, and so they're looking for something that potentially a lot of people aren't going to be producing. So they gave me 2 weeks of antibiotics. They tested me and said basically if it was Lyme, it'll be gone now. I did get referred to infectious diseases as well, who told me on the first appointment that my symptoms most definitely did not fit the pattern for Lyme. And, you know, as you've just discussed, there's not really a pattern for Lyme. It's very individual.
Yeah. We've also got with us Dr. Sandra Pearson, who's the medical director of Lyme Disease Action. She's in Vienna at the moment, so if there is a slight delay on the line, we'll just bear with it. Good morning to you, Sandra.
Good morning, Susan.
It's Kaye here.
Hi. I'm sorry, Kaye.
Oh, no, don't worry. I think Susan's through the other side of the glass there. You've probably already been speaking to her this morning to get the line set up. Sandra, we've decided to return to Lyme disease because every time that we do an item on the programme, it's like peeling an onion. You know, there's yet another kind of complication. It's a very difficult thing to get your head around. I'm struggling, to be honest, at the moment. And I have to say, we're not here to advocate or endorse any particular response to it or treatment for it. But what Dr. Jess Armine has been telling us, and listening to Ingrid here, whereas previously I might have thought as a layperson, well, you know, this is a difficult thing to actually identify because it comes from this tech and it's sometimes getting missed, but as long as the doctor diagnoses it, you'll get a course of antibiotics and the antibiotics will sort it out. Now, that was my very simplistic understanding. What I've been hearing this morning particularly is that is far too overly complex, and that actually it's like a collection of symptoms and impacts on the body, that people react differently to it, that there is no one cure or treatment for Lyme disease. Is that your understanding or not?
Well, I think you're right that there is complexity to Lyme disease. The problem is that it's actually can be quite difficult to research late-stage Lyme disease. So most of the outcome studies and draft NICE guidelines were published yesterday. They're of limited quality anyway, but it's easier to research when maybe you're in the early stages and possibly there is a rash there to see or some outward sign or definite antibodies. But it becomes much more difficult in late-stage Lyme, where the illness may be chronic and the symptoms overlap with a range of other chronic conditions. And the big problem is whether you can stretch the evidence from early Lyme disease to late Lyme disease. We do need better tests. I mean,
the catalogue of symptoms, the catalogue of symptoms that Ingrid gave us there, going back to, and I think, Ingrid, you said you're in your sort of late 30s now, going back to her teens, a whole catalogue of things. Can you see within your knowledge that those would all be ultimately linked to Lyme's?
Possibly, but possibly not. One conversation we've been having here this morning, and this is a Lyme disease, tick-borne disease symposium, is what about the people who don't fit the strict criteria for Lyme diagnosis and have subjective kind of non-specific symptoms like headache, fatigue, pain? Those are quite common symptoms in a range of chronic diseases. They are the kind of symptoms that tend to be dismissed but can be incredibly debilitating for Lyme patients. And the problem is that at that stage, there's no biomarker, there's no test of Lyme disease activity or a test of cure. A doctor doesn't know whether it's immune dysfunction, sort of the immune system playing up, or whether there is tissue damage, or whether the bacteria is able to persist at low levels, kind of more of a sort of sleep, dormant condition in deep tissues. So it's hard to find the bacteria, it's hard to grow it in culture, especially after antibiotics. The science on this is currently unsettled.
So I mean, is
controversy?
Is the medical profession basically putting its hands up and saying Lyme's too clever for us? I mean, I don't mean that to be judgmental necessarily, but is that where we are?
I think what we need is that we do need better medical education. And just like here, we need the doctors who are diagnosing and treating Lyme disease to actually have some dialogue with the scientists and the patient community. Late-stage Lyme can be genuinely difficult to research because of the difficulty with tests and knowing what's happening. And because there is not one solid group of Lyme patients. Some may have more autoimmunity, some may have more persistence. But we do actually need more collaboration and less of this kind of gladiatorial approach as there is at the moment, sort of shouting at each other across this divide.
Yeah.
The controversy can actually get in the way of research and proper dialogue as well.
Well, yes, because what's undeniable is that there are lots of people out there whose lives have been seriously blighted by this condition, or which they believe to be this condition, and they don't know where to turn with it. I mean, Ingrid's story, they're 20 years of her life blighted by kind of not really diagnosed symptoms. And I know, Jess, you're desperately keen to come back in, and I will, but I just wanted to read this text out, which again is evidence of the people who are out there and just, befuddled as to what to do. Our 4-year-old son has been ill for 1.5 years. He had a bite and the classic bullseye rash. He displays many Lyme symptoms: fever, aches, joint pain, tremors, shakes, extreme fatigue, breathing problems, which peak every 4 weeks like clockwork. This results in hospitalisation or a trip to A&E. He had 6 weeks worth of amoxicillin, an antibiotic, a year after the bite. The treatment was in Ireland. After this, he was okay for 2 months. Symptoms are all back now. We cannot get a doctor to help. What should we do? We are extremely worried. I mean, what a situation to be in. We'll just let Jess respond, Sandra.
Yeah.
Sandra, I agree with you that there needs to be more solid scientific evidence, but the fact is presently there isn't, although I will have to respectfully disagree that there are things we can study that give us indicators towards chronic Lyme disease. I think the basis of the difficulty is our insistence on evidence-based medicine requiring double-blind placebo studies before we move on something. There is anecdotal evidence in great quantity of chronic Lyme disease. What happened with the first patient who was speaking was a cascade effect over many years that may have started with Lyme disease, but may have started with something else, but it started a cascade effect that affected the immune system, the gut, the cell wall function, and thereby the ability for her to fight infections. Concerning late-stage Lyme disease, as you're well aware, being an expert yourself, the initial antibody tests, even the Western blots, are unrevealing if you do them before 3 weeks after the bite or after 6 months. But you can in fact culture the microorganisms. There's a laboratory in Philadelphia that does exactly that. And you can do also ELISpot testing, which is testing of the white blood cells, where they'll take the white blood cells, they'll culture them, and then put antigens in, and then culture them for several more days. And you can tell by the response of the T cells whether you've had Lyme disease or not. Now, granted, you're talking about past infections. So let's say 0, 1, and 2 is considered negative and above 3 is considered positive, and your number is 75. Well, all I have to do really is if I have taken a history of a patient and it sounds like one of the permutations of Lyme disease, and I've got this ELISpot test that says, they've had a bunch of stimulation of T cells over time, and all I have to ask the patient is, have you been treated for Lyme? And if they say no, then I know they have chronic Lyme disease. It's not a direct test, okay, but it's a good indicator.
It's obviously really difficult for us to get into the complexity of the science in this forum, though. I mean, it's absolutely fascinating to listen to.
Can I just come
well, Sandra, we are really stuck for time, Sandra, I have to say. We really are stuck for time. And, I just wanted to say to you, we've got Dermot and Teresa here, just, a couple with a 4-year-old boy that they're really, really concerned about. What do you advise people in that situation to do?
I mean, our charity doesn't give advice, and I can't advise over the phone in this.
But I mean, they're saying we cannot get a doctor to help. We're not saying to give them a prescription, but I mean, you've got a 4-year-old child, your child that you're desperately worried about, and you can't get a doctor to help you. And you think it's Lyme disease?
I don't know the circumstances of the case, Kaye.
The circumstances of the case.
Agreeing with.
My apologies. The circumstances of the case, obvious to me, is that the Lyme disease, if it was Lyme disease, which I'm pretty sure of, was treated suboptimally. Okay, 2 weeks of antibiotics, if I remember the story correctly, is quite insufficient.
6 weeks of
my apologies.
amoxicillin.
Amoxicillin may have been the wrong antibiotic.
Yeah.
Okay, we need Lyme literate MDs, people who are trained by ILADs, who are willing to pick up the gauntlet and follow this disease and look for the co-infections.
And forgive me, Sandra, I wasn't asking you to give a diagnosis or a prescription or whatever, but I mean, as a medical director of Lyme Disease Action, which is a charity, there are people out there who are saying, help, they need a direction to be pointed in, and it's been a really fascinating 40 minutes. But I'm not entirely sure that people out there who are concerned about it will have any clear idea of where to go, which is a great shame. Sadly, we are out of time. Sandra, thanks very much for sparing the time for us from Vienna. Dr. Sandra Pearson from the Medical Director of Lyme Disease Action. And Jess Armine, thank you very much.
Thank you for having me.
And I hope your time in Scotland is productive.
It has been. I'm enjoying it very much.
Thank you very much indeed.